Hello friends, today we'll be discussing about internal hernias. So before starting, I would like to thank Chandana Shri Ma'am for sharing the wonderful notes with us. These notes are very helpful for quick revision and the link for the notes is given in the description. You can download it from there. So without further delay, let's start. So internal hernia, these are intra-abdominal hernia causing visceral herniation through the defect in the abdominal cavity. So there is some defect in the abdominal cavity through which either intestine or part of other organ can herniate and cause ischemia, pain and other troubles, obstruction. So what are the types? Internal hernia defects. It could be developmental, congenital or acquired. So developmental, it could be due to abnormal midgut rotation and fixation, that is the paraduodenal or a mesocolic hernia, which could be right or left, due to abnormal large intestinal foramina or fossa, that is foramen of Winslow hernia or paravesical hernia. Then abnormal mesenteric defects, that is pericecal or intersigmoid defects. This was the developmental or congenital ones. Then we have acquired, that is mesenteric defect created during bowel anastomosis, hepaticojejunostomy or Roux-en-Y gastric bypass, which name is Peterson's hernia or retroanastomotic hernia. So these are some of the internal hernia, and we can see in the diagram various hernias. That is the first here, the B is the foramens of Winslow hernia. Then F is the Peterson hernia. Then A is the right paraduodenal hernia, and besides is the left paraduodenal hernia, and this F is the transmesenteric hernia, D is the paracecal hernia, E is the retroanastomotic hernia, and C is the intersigmoid hernia. So these are various hernias as we can see in the diagram. Now we see the hernias in detail. So paraduodenal hernia or mesocolic hernia, where the small bowel herniates behind the mesocolon due to midgut malrotation. In right paraduodenal hernia, there is prearterial duodenojejunal limb of the midgut fails to rotate, while the postarterial limb, that is cecocolic loop, rotates. So this imbalance in the midgut rotation causes this hernia. There is defect in the jejunal mesentery behind the SMA below the third part of duodenum, that is the Waldeyer's fossa, which creates the below behind. In this defect the hernia is created. So most of the small bowel lies in the right of the SMA between the two leaves of the ascending mesocolon, and SMA lies just medial to the neck of the sac. So ileocolic, right colic and middle colic vessels lie on the anterior wall of the sac of this hernia, and sac is opened along the lateral attachment of the ascending mesocolon. So along the lateral attachment of the ascending mesocolon, we open the hernia sac and then treat it. So from the Waldeyer's fossa, which is the defect in the jejunal mesentery behind the SMA below the third part of duodenum, where is the defect. Now the left mesocolic hernia, where the small bowel herniates through the defect between the inferior mesenteric artery and the posterior attachment of the descending mesocolon on the left side. In utero, the inferior mesenteric artery forms the medial relation of the neck of the sac, and sac is opened at the avascular plane just medial to inferior mesenteric artery, and this one is more common. Then foramen of Winslow hernia, where the small bowel or cecum herniates through the large foramen of Winslow behind the free edge of the lesser omentum or hepatoduodenal ligament. So just behind the lesser omentum or the hepatoduodenal ligament in the upper abdomen, the small bowel or cecum can go through it if the foramen is large. Now the clinical feature, it may present as obstruction, could be acute, subacute or recurrent. and can cause strangulation. The diagnosis is generally made intra-op, but can sometimes be also diagnosed with imaging through the CT scan, contrast enhanced CT scan. Now the management, for this we should have a good knowledge of anatomy and mechanisms, and whenever possible we should try reduction and defect closure. In the case of right mesocolic hernia, the sac is opened along the lateral attachment of the ascending mesocolon as discussed, and the right colon and cecum are reflected to the left, and then it assumes the position of the non-rotation, so it becomes normal position. In the left mesocolic hernia, the incision of the peritoneal attachment adhesion along the right side of the inferior mesenteric artery and delivery of the herniated intestine from beneath the inferior mesenteric artery. So this was all about internal hernias, and hope it has been understood. And please like, share and subscribe. Keep studying, keep growing, and never give up, because great things take time. And see you in next video. Thank you.